Hi, good evening, everyone. Welcome to the COVID-19 Community Town Hall, which is presented by UP Health System Portage. I'm Steve Elmer. I'll be joined shortly by my colleague and co-host, Dr. Kelly Kam, who is our epidemiologist here. We're both members of the Health Research Institute and college professors at Michigan Tech University. Tonight, we're broadcasting live from the Student Development Complex. Our presenters are joining us from their homes and offices here in the community, and we're excited to welcome all of our viewers that are watching tonight on the Zoom webinar, on Facebook Live, and those listeners tuning in on 97.7 The Wolf. It's great to have you with us for another town hall. I need to recognize our sponsors. Again, our presenting series sponsor is UP Health System Portage. We also need to recognize the MTech Smart Zone, the Upper Peninsula Power Company, Aspirus, and the Physiological Society. It's important to note that our town hall series is organized by the Health Research Institute, along with support from the Center for Educational Outreach. We appreciate the support of both our campus partners and local community sponsors for helping us make the broadcast possible tonight and every Thursday here this fall. The mission of the Health Research Institute is to support health-focused education and training for students, research for our faculty, our scientists and engineers, and also to support health-focused outreach both on the campus and in the community. Each week, our goal is to help increase our collective awareness about COVID-19, the disease, the pandemic, and how it's impacting our health, the health of our community, and the health of society at large. To do that, we bring in a panel of experts each week to highlight what they know, what information is changing and emerging, and importantly, answer questions from both students, faculty here, and also community members. Tonight, we're going to focus on how our faculty, our students, and our staff are doing their part to respond to the COVID-19 pandemic. We have a great lineup of speakers, and Dr. Kam will give us a preview here in just a couple of minutes. I want to mention and emphasize, too, that if you missed any of our previous town halls, we do focus on a different COVID-19 related topic each week. If you go to our website, you can download the recorded versions and get up to speed on all things COVID-19. That website is mtu.edu/health-research. Once you're on the page, go ahead and click on the COVID-19 Town Hall button at the top. You'll be able to pull up all of the recordings there. With those announcements in mind, I want to welcome in and say good evening to my colleague and co-host, Dr. Kelly Kam. Dr. Kam is an assistant professor in the Department of Kinesiology and Integrative Physiology. She's leading the contact tracing efforts here on campus. So Kelly, good evening, and looking forward to working with you tonight.
Thank you very much. I'm glad to be here.
Okay. Well, Kelly, I know you have a couple things for us. First, could you just start with a preview of who's here tonight? We have a great lineup of speakers. And then I know you have a few public health updates and a couple of resources for us too. So let's start with a preview.
Sure. So as we've been talking throughout our series here, there's been a lot of different efforts that have been going on through individuals in our community, organizations within our community. We're all forging a little bit different path as we handle and try and figure out how we can support our community in this pandemic. So here at Michigan Tech, we've had quite a variety of different aspects that people have been working on. We're going to start with Karen Fay, who's going to talk about Michigan Tech COVID Lab. So prior to this pandemic, we certainly didn't have a diagnostic lab here at the Michigan Tech University. We had lots and lots of research labs, but not a diagnostic lab. And we now have a diagnostic lab that's been very supportive in our efforts up here to be able to identify and test locally. We have David Holden from Michigan Tech and Innovation. Early on, we had quite, as everybody else was suffering or was trying to figure out how we were dealing with supply chains of having masks and PPE. Michigan Tech and David Holden's group stepped up to be able to develop use some of the 3D printing to be able to develop some PPE. Jennifer Becker's been leading an effort to be able to do a different kind of surveillance system. So instead of looking at people and trying to test people, she's working on looking at what we can do within our wastewater to look for people who are shedding the virus, because we do know that we're releasing this virus through a variety of different biological specimens. And that's a really unique way of being able to look for the virus and see if we can tell what's going on in our communities. And finally, we have Isaac Wiedig, who's a doctoral student within our home department here in kinesiology and integrative physiology. He's been working on our the Up and Moving project to get our community up and moving and some exercise that they can do at home with a group of dedicated graduate students that have been doing an excellent job with that.
Okay. Thank you, Kelly. For our viewers out there, we have a visual here with some very helpful resources that we've compiled. You can see we're actually running out of space here, but over the past several town halls, we've added this. And Kelly, for our listeners out there who might not be able to see this, of course, could you just hit the high points for us on where to go to find that credible information? That's one of the goals of the town hall. We really want to point people to those credible websites and resources.
Certainly. So any of our public health facilities, so your local health department, such as our Western UP Health Department, wherever you are, your local health jurisdiction will have information on their websites. Federally, we have things like Centers for Disease Control and Prevention. State of Michigan has things at their Michigan Department of Health and Human Services. And globally, we have information at World Health Organization. There's also different private organizations as well as universities. Michigan Tech certainly has lots of information on our Flex website. Other universities such as Johns Hopkins and Harvard also have lots of information on their websites that are a broader global and domestic description, as well as any of your health systems. So our local health systems here, UP Health Systems Portage, Aspirus, and Upper Great Lakes, all have information both for treatment and individuals who are seeking treatment and seeking care for COVID-related health, but also general information, as well as our student organizations and some of our student work that's being done, such as the program that Isaac's going to speak about, Up and Moving, as well as the tech tutors, which was another aspect that we spoke about in a previous week of students reaching out and developing systems to be able to help our local community during this time.
Yeah, Kelly, and it's important to note too, a lot of these resources here we'll notice are .org, .gov. That's important for folks to know when they're trying to get their COVID-19 related information. And next, Kelly, I know every week we have a mini public health update. It seems like a lot has changed just in the past week since last Thursday, especially with the case counts and things here locally, nationally, internationally. So take a few minutes and just bring us up to speed on how things are looking as of tonight.
So absolutely. So in the past, we've done a little bit on some of the myth busters, but with the holidays coming up, I wanted to give a little bit of a description of why we're talking about being careful and thinking about where you're potentially bringing the virus if you're going home or headed up to see family and friends for holidays. So this was an outbreak that happened this summer. It's a very similar area in northern Maine as we have here in the Keweenaw area. It's a rural area, small towns, not a lot of healthcare capacity there. And there was a wedding that happened at that time, and the wedding had 55 people at the wedding. And from that wedding, there were 177 cases directly linked to that wedding, including 7 deaths. So of the 55 people that directly attended the wedding, there were 30 cases of COVID from that. And those 30 people then spread it to an additional 27 people in the community. It spread to a long-term care facility, and that's where the majority of the deaths happened, as well as spreading to a correctional facility that was more than 200 miles away that led to 82 cases within that correctional facility. So the person that was what we call the index case, which is the first person that was recognized as being the earliest case in that cluster of people, actually attended the wedding before they got sick. So the spread happened in that 1 to 2 days prior to developing symptoms when you're able to spread the disease. And I want everybody to remember that as we're going home and meeting with family and friends, that we really have to think about that. Even if you're feeling well, you really need to take some steps so that you can be able to celebrate this holiday and future holidays safely. And that may mean that your celebrations look very, very different this year than they have in past years. So a little bit of just reminders of things that we can do to try and make our holidays safer. So if at all possible, consider limiting your travel. Think about how you're traveling, as well as if you need to travel at all. And the idea with that is that we know, as you'll see in some future slides, that we have spread just occurring throughout the United States. But do you really want to be the person who brings COVID home with you? Or when you return, that gets COVID wherever we're at and bringing it back to where you live. So if you can consider limiting travel to reduce that risk. If you do have a holiday celebration, the smaller gatherings you can have, the better, limited to people that we live with already. But if you do have a celebration with people outside of your household, then certainly think about, is it worth it to include elderly people or people at high risk at your table? Think about, we have a lot of creative students out there, a lot of creative people in our communities. Are there other ways that you can include those people in your celebrations that doesn't include sitting them at the table and putting them at risk of being exposed to someone who may have traveled and had the virus? If you can, again, with the smaller travelings, don't mix your social circles unless they've quarantined too. So as many of our students think about that, I'm sure they miss their friends that from high school that I went to Michigan State or U of M or are coming home. But they're bringing home what they've been around too. And unless you know for sure that they've been quarantining for 2 weeks prior to coming home and you've been quarantining for 2 weeks before coming home, then mixing those social circles. We heard about that from Dr. Perret back at one of the earlier meetings, that we're just mixing our social circles and that's how we spread it even faster. And no matter what you do, remember to wear your mask, wash your hands, watch your distance, and definitely I ran out of room here, but we're all going to eat a whole lot here. So remember to walk to keep your, allow you to fit back into your pants afterwards. One of the other things to note is as we have cases just exploding across Michigan, many of our health departments are being overrun by cases. And that means that sometimes they're not as quick to be able to get to those case interviews with the positive cases. So we have to take a lot of responsibility individually to make sure we know what to do if in case we do get sick. So if you get sick and the symptoms that we're looking for COVID, they are very vague symptoms, except that loss of taste and smell is kind of one that you don't get for normally other things. But if you're getting one of these symptoms, maybe don't automatically think it's COVID, but if you're getting a spectrum of these symptoms, really consider that even if you didn't have a close contact with someone, you may have COVID. So if you do get sick, you need to isolate yourself away from everybody else, including people you live with in your household. We know that you're infectious at that point and we don't want you spreading it to other people. That means staying in a bedroom away from other people, only leaving to use the bathroom, if at all possible, having meals delivered to the door so there's no interaction with you and other people in your household. If it is COVID, that means you need to isolate yourself for a minimum of 10 days until your symptoms are resolving and you have not had a fever within 24 hours without taking fever reducing medications. Get tested. We need to know if you actually do have COVID so that we can know what's going on in our community. And also take it upon yourself to notify your close contacts if you do test positive. Notify those people who you've been in contact with for more than 15 minutes, less than 6 feet away, anytime starting 2 days prior to when you started to get sick. Remember, from that wedding, you can get sick and you can infect other people before you get sick. So you have to notify those close contacts because, again, the health departments may not be able to reach out to you quickly enough and get that information to the close contacts. And if someone you know notifies you that you are a close contact, remember to quarantine yourself for a full 14 days after that close contact. So as I mentioned, we've got cases just continuing to increase across the United States. So as we all focused on the election, the virus continued unabated. As of, I believe that was November 10th with the date there, 143,000 cases across the US in one day, 10,000 more than the day before. We are on an upward exponential growth. It is something we can stop. If we do follow the public health recommendations, we can slow this. We've done it before. We can do it again. And just to give you an idea of what's happening in Michigan, oops, my arrow's a little bit off there. That peak there, that was just a few days ago. That was in Michigan. We had over 9,000 new cases of coronavirus identified in one single day. Those drop-offs for the next 2 days after that, don't get complacent on that. That may be a reporting error. So there may be just not full data available for those dates because they are recent dates. And then the picture of Michigan in the upper left-hand corner there, looking at the deaths per 100,000 people in the population. So this is giving you an idea of comparatively across the state, where are the most deaths occurring. So this is not straight numbers, this is per population. So that we know here in the Upper Peninsula, certainly our populations are much smaller than they have down in the Detroit area or any of our other urban areas. But when we see some of those darker areas down along our southern UP border there, that's very concerning. We have a lot of deaths for the population that we have there. And again, if we can get those case levels down, we will not get to those deaths, but we have to get the cases down in order to help get those deaths down as well.
Okay. Well, thank you, Dr. Kelly Kam, for the public health update. A lot has, certainly those cases sure have jumped up in the last week since we were on the program. We will come back to you with a few more questions throughout the program, so stay tuned. Next, I have really the privilege to introduce Karen Fay. Karen is a professor of practice here at Michigan Tech. She just retired earlier this year. She's also now serving as the laboratory liaison for the COVID-19 testing lab here through our Vice President for Research office. So Karen, welcome to the town hall. Thank you so much for being here. We're looking forward to learning a little bit more about how Michigan Tech set up this diagnostic lab here right on campus. Just going to have Karen unmute the microphone here.
Sorry.
There we go, Karen. Welcome to the
Okay.
town hall.
Thank you. This is an amazing thing that happened. And I just want to reiterate this over and over. It's incredible what happened at Michigan Tech when the call to arms, so to speak, was rallied. We started out with just a handful of people that had any kind of clinical background, myself being one of those, and the other people specifically in the medical lab science program that have had hospital laboratory clinical experience. And we got a call from the state that said, we really need help in the Western Upper Peninsula. Can you people put together a way to do this? And within a few short weeks, literally weeks, we had the beginnings of a running operational medical clinical laboratory. And it's a diagnostic lab. We use gold standard equipment. We use PCR, and that truly is the gold standard. We found a pathologist who act as our director of the laboratory. We are blessed with very talented people across campus that understand PCR, the tests that we do. We had, as I said, we had people with clinical backgrounds, and we had lots and lots of people that were willing to help. And from this group of people, we self-selected, literally. Everybody kind of said, I can do this, I can do that, I can do this. And pretty soon we were operational. And it is nothing short of miraculous. And I'm not trying to overemphasize that. It's truly the truth. And so where we are today, we started out by running a few samples that we had to get verified. We had to get FDA approval. We had to get CLIA, which is a medical term accreditation to be able to run lab at Michigan Tech. We got that all approved. And as I said, we set up this lab. We started by doing just a few dozen samples. To date, we have done, and this is as of yesterday, over 17,000 samples. 17,000 samples. And of those 17,000, 10,000 of them have been community samples. And as I said, when this started, the Lansing asked us to help testing in the Western UP. And so we did. And of those 17,000, 10,000 of them have been community samples. The other 7,000 have been for Michigan Tech, for students, for faculty, etc. And one of the things that's my position is the liaison of the laboratory. And basically what that means is somebody has to be the contact person between the lab and the hospitals, the nursing homes, the long-term living facilities, that kind of thing, the people that need this testing done. And so I have been in contact with those people regularly during the day, during the week. If there's any questions they have, they know they can come to me. I probably may not know the answer, but I find it out and get back to them as soon as I can. And vice versa, if there's some information that needs to go out, then I contact everybody and let them know. And that's so everybody's on the same page. They know what's going on. There's no questions. And that's to make things safe. So right now we're running about 54 employees. And that doesn't just mean people working in the lab. I personally rarely see the inside of the lab. I'm working out of my home. But that being said, I've been in the lab and I know the people that work there. But these 54 people are from across campus. They are everyone from researchers to graduate students to, as I said, clinical laboratory people, administrators, billing, scheduling, everything that we need. I can't even begin to tell you how many people are involved, and they all take this so seriously. And as I said, it was all self-selected. It was like, oh, we need somebody to help us with the safety aspects of the lab. Boom, we had 2 people with safety experience helping us out. And so it's just been remarkable. And as I said before, nothing short of a miracle. So the newest thing is we got a grant from the Portage Health Foundation to help us purchase a brand new analyzer. As I said, we're doing PCR, which is the gold standard, but there is a new analyzer that we have purchased, and it is a PCR analyzer. It's a newer model, and this analyzer is going to allow us to double our capacity of how many tests that we can run a day, an hour. And another bonus on that is it'll give us, we can do it with less people. So we don't have to be working people more than what they're comfortable working. And so more samples, less lab workers, high quality, it's very sensitive. And I'm very excited about that. It's in-house right now. We are busy doing the setup on it and the validation studies, et cetera, that needs to be done to make sure that the results that come out of this analyzer are absolutely spot on correct. And we're looking at opening this new avenue right after Thanksgiving. And so we're real excited about that. That'll give us another couple weeks to get all the studies done that we need to do ahead of time. So that's kind of what's new in the lab. It's a great place. The last thing I want to say is that the lab, it consists of the actual laboratory work consists of 3 parts: the preclinical, the pre-analytical, the analytical, and the post-analytical. And they're all very, very important. And if one doesn't work right, nothing works right. And again, we're really fortunate that we have all 3 of those areas covered by very competent people. So the pre-analytical is anything that happens before the sample gets to the people actually doing the test. So that starts out with the specimen collection, how the specimen is handled, how it's logged into the lab, etc. The analytical is where you're actually doing the test on the, there's 2 parts to the test. There's an RNA extraction part and then the PCR. Those 2 things would be considered analytical. And then post-analytical is what happens when those results are reported. So once the instrument says it's positive or negative, post-analytical is getting those important results to the physician, the provider, ultimately to the health department and the patients. And again, we're very fortunate that we have very competent people in all 3 of those areas. So for anyone working in the lab, I just want to say thank you, because it's a huge responsibility and they're doing a tremendous job.
Thank you, Karen, for the update. I want to ask one quick question here about the new testing equipment and software that you got through that Portage Health Foundation grant. You mentioned doubling the capacity. Can you just speak broadly, what does that mean for the Western UP if you're able to double capacity? You talked about, some from the community, some from students, but yeah, what does this mean for the community now that the testing lab has the potential to double their capacity?
All right, well, I can give you an example. We were asked recently by one of the counties in our area to help with some testing for a nursing home. They needed to test all of the workers in the nursing home weekly. And there were only certain days that we could actually do that and get them results timely. And so now when we're asked to do things like that, it's like, sure, send them over. We'll be able to do them and get you these results tomorrow. So it's huge. It's just huge. They don't have to send them someplace else and have to wait 3 or 4 days to get results.
Okay, fantastic, Karen. Thank you. We're going to move on to our next presenter. Just want to remind folks, if you are just joining us and would like to see any of the visual content, you can go over to thewolf.com. On the website there, for the listeners out there, you can click on one of 2 links to join us on the Zoom webinar or on Facebook Live. Tonight, we're here for the COVID-19 Community Town Hall, which is presented by UP Health System Portage. If you do have questions and you're on Zoom, you can use the Q&A button at the bottom, or you can send it to our email address at townhall2020@mtu.edu. Our next presenter is David Holden. David Holden is the manager for technology and innovation here at the library at Michigan Tech University. David's going to be talking to us more about the 3D printing of personal protective equipment. So David, we're looking forward to a brief update from you, and thanks for being here tonight.
Oh, thank you. Thank you, Dr. Elmer. So as I was going over this, I think the best way to make sense of our COVID 3D printing activities here at the Van Pelten OP Library is to do so historically. You'll recall that at the outset of the pandemic, there was a loud outcry from the healthcare sector regarding high rates of consumption of personal protective equipment, that PPE, and critical shortages of it that were hampering care and endangering frontline responders. Now, reviewing the capabilities and relationships we have here at the library, John Schneiderhan, our technology specialist, found a simple design for a face shield in the larger open source community. Reviewing it closely, we decided that our small group could start manufacturing it and actually have an impact. The first open source design we had was a simple halo that wrapped snugly around the head and had a moderately small shield that could be made from standard clear laminating pouches. Working with Pete Barrell of the Western UP Health Department, we made a dozen prototypes that he gave to medical staff first responders to get feedback. And the feedback came in pretty quickly. Within a couple of days, we had revised the design in numerous ways, pushed the shield away from the face so that other PPE could be worn under it, increase the size of the shield so that it extended further below the face, taper it so you could swivel your head back and forth more freely, and make the halo larger, extending it further back to improve comfort. With further testing of those modifications, Pete gave us the approval to produce it and distribute. Our university counsel, Sarah Schulte, worked with us on developing language to include with our distributions. Jody Lehman in development, the Portage Foundation, and Jackie Huntoon, our provost, quickly came up with the funding that we needed to make it happen. Cecile Perret of the math department, our campus makerspace, and the open source MOST lab run by Joshua Pierce all added additional 3D printers to supplement our manufacturing muscle here in the library. From late March through May of this year, we ended up producing and delivering over 3,000 reusable face shields into the community. I must mention at this point that we were not the only ones in the community doing this very same thing. A confederation of local 3D makers led by a gentleman named Drew Kramer built on the same design that we were working with and turned out untold numbers of shields into the community as well. By the end of May, Pete Barrell shared that we had saturated the market and shields were once more available in good supply. But it turns out that this was just the first phase of our shield production. In July, the provost asked us if it would be possible to enhance our design to assist with the safe return of students to limited in-class instruction. After some discussion as to what this would reasonably require, we produced prototypes of our next revision and distributed them to a wide variety of faculty and research testers. The major modification we made was to shape the Mylar shield in a manner that contained exhalation, diffusing it and directing it behind an instructor, while also accommodating the computerized headset or the AV headset that was necessary for online sessions. The instructional testing feedback we received had us wrap the shield even further around the face and under the chin, add some padding, and increase the size still more. And I'm coming to the realization that I just have a narrow head. Most importantly, we sought the assistance of Will Cantrell and Raymond Shaw's research groups in physics to measure and assess the shield's effectiveness in an instructional setting. They devised a testing routine that they called a worst case scenario and measured the shield's effectiveness. Their testing, which among other things involved Dr. Shaw reading passages from George Orwell's 1984, indicated that even in a worst case scenario, the shield reduced respiratory sized particles to below detectable limits. With these results, the provost commissioned us to proceed to manufacture. Since late July, we've distributed nearly 1,200 of these instructional shields for on-campus use. Apparently, unlike medical staff, our faculty and researchers are wonderfully free with their critique. I think the most sanguine feedback I've gotten is that they are adequate. And the most critical feedback I received is, well, it's not suitable for radio. Nobody loves teaching from inside a shield, but they are a reasonable, safe part of enabling in-class access to instruction. What this all means is that here at the library, we're continuing to work on improvements to the instructional face shield. Most of which that we're working on currently are incremental changes, and some are revolutionary changes to design completely. especially to come up with design modifications for folks for whom the current face shield simply doesn't work. And we're doing this all in preparation for whatever we're going to produce and deliver to the campus for the next semester.
Okay. Thank you, David. I commend you and your team for your efforts early on in the pandemic, and I've used a shield myself, so thank you. One interim question for you as we continue on with our town hall. Walk us through the process of the printing, and once you have the shield, how do you know it's safe, it's effective? Do you work with OSHA? What standards do you have to kind of work through before you distribute this?
So the safety work is work that we've worked with the open source community as far as that goes, and that goes through a review with any number of folks. But primarily, it was the work that we did with our own physics department here, in terms of using the atmospheric equipment that they use to determine the suppression of droplets that people would produce in an instructional environment. So
Nope, go ahead, David. Go ahead.
As far as the printing process of it goes, we have an array of, at this point, I think 8 Lulzbot printers. They're fused filament printers that produce a thin plastic halo that we've worked with the engineering department to come up and make sure that it's as strong as it can be and be as light as it can be. And we use a 7mm Mylar that we cut on a CAD cutter and assemble by hand. We also then package them and leave them to sit for at least 3 days before we distribute them.
Okay. David, one more question for you. If there are other educators out there that aren't part of the university at some of our K-12 schools, they've been on the town hall as well. If they're looking for shields, is there any opportunity to collaborate or connect with you, or can you comment on that?
Yeah, absolutely. So this is, I say that we've turned them we've turned out 1,200 into the community. Well, actually 700 of those have gone to Michigan Tech. The balance have actually gone to other educational institutions or users around the community. So there certainly is a pathway for that to happen. What folks generally do is they would email me, doholden, DOHOLDEN @mtu.edu, and I go through whatever process we need to go through with the university to clear that.
Excellent. Thank you, David. We'll circle back with a few more questions. Reminding folks again, you can send us questions using the Q&A button at the bottom of the Zoom webinar. You can also email those to townhall2020@mtu.edu. Next, we welcome in Dr. Jennifer Becker, who is an associate professor in the Department of Civil and Environmental Engineering here at Michigan Tech University. So Dr. Becker, welcome to the program. And I know you're going to tell us more about your research and your work in monitoring the virus in the wastewater treatment.
Great, thanks. It's great to be here. And if you'll advance to the next slide. So again, I'll be talking about something we call wastewater-based epidemiology, and I'll specifically focus on how we're using it to monitor SARS-CoV-2, which is actually the virus that causes COVID-19. And we're doing this at Michigan Tech and throughout our Western UP communities. Next slide, please. So wastewater-based epidemiology has actually been around for a little while. It's been used quite a bit in Europe, and it's starting to take off here in the United States. Specifically, we can use it to track trends in community health. For example, we can get information on the use of prescription and illegal drugs, alcohol consumption and tobacco use, exposure to environmental toxins, and what's really relevant here tonight, infections of individuals and the spread of pathogens, disease-causing microorganisms. So historically, we've been able to use wastewater epidemiology to track polio virus, for example, in developing countries, hepatitis A, influenza, and now, importantly, SARS-CoV-2, again, the virus that causes COVID-19. And I think it's really this COVID-19 pandemic that has highlighted what a valuable tool wastewater-based epidemiology is. And basically we can use wastewater to get a picture of community health because, as is illustrated quite starkly in this image, most of the things that we consume as individuals, whether it is drugs or alcohol, or we get exposed to toxins, or we get infected, those things leave a signature or a biomarker in either the urine or the feces. And of course, those find their way into the wastewater stream, and they retain that signature for some time. So we're able to go in and actually sample wastewater, which reflects, not individual behavior, but behavior within the community, or spread of disease within the community. We're able to go in and take samples. As you see on the right, you're collecting a sample up in the wastewater treatment lagoons in Copper Harbor, and get a picture of these different factors that affect community health. So next slide, please. So Karen Fay talked quite a bit about our wonderful diagnostic testing lab here at Michigan Tech's campus. And this wastewater-based epidemiology actually complements the diagnostic testing, the testing of individuals that goes on at the Michigan Tech testing lab and other facilities. And the reason why it's so useful and complementary to that diagnostic testing is that people start to shed the virus. Again, we get this signal, and for viruses, for pathogens, the signal is primarily in the feces. And that shedding can begin to occur before people actually develop symptoms. So another related advantage is that we can start to see the virus appearing before people seek out testing. And often it's that development of symptoms that causes people to seek out a diagnostic test. Also, wastewater-based epidemiology or monitoring is quite cost effective. Again, we're getting a picture of infections among not just in one individual, but an entire community. So let's take a look at how this works. So we see down in the graphic on the left-hand side, we have a certain population of people here at Michigan Tech. We're particularly interested in populations within residence halls. And again, if an individual is sick, they will begin to start shedding the virus in the feces. And here the infected individuals are represented by the little red people. The feces, the virus particles, again, find their way into the wastewater collection system or our sewers. And then we're able, again, to collect samples. So we either do that with a wastewater sampler, a pump effectively that you see there in the middle of that image, or the dipper that we saw being used up in Copper Harbor. So we locate manholes that capture flows that we're interested in, and I'll talk a little bit more about that later, or we can go directly to a wastewater treatment plant and get a complete community picture sample there. The next step is to process the sample. And again, this very closely mimics what is done in the diagnostic testing lab. In fact, we use the same technology that Karen Fay was talking about, PCR, to quantify the virus. So, but the amount of virus in the wastewater is extremely small because the wastewater flow includes all of the water that goes into our drains. So shower water, water from our washing machines and sinks. So in the end, we have a very low concentration of virus. So the first thing that we have to do is really concentrate that virus. And then we begin the process of extracting it like they do in the diagnostic testing lab, and then applying PCR. In the diagnostic testing lab, we're primarily interested in whether a person is infected or not. So it's positive or negative. Here with wastewater epidemiology, we really want to know the absolute quantity of the virus so that we can characterize trends in the virus abundance over time, or geographically within what we call the sewer shed. So you see on the right that if a community does not have COVID-19 present, that we would be able to see the emergence of COVID-19, and hopefully we also will see its subsidence. We can also dig a little deeper if we see a signal of the virus occurring. For example, if we see virus appearing at the wastewater treatment plant, we can go up into the sewer shed, as we call it, and try to find out where it is coming from. Again, go to a manhole maybe that captures flow from a nursing home, a school, a prison, and find out where are our hot spots. So that's one of the ways that we can use the information from wastewater-based epidemiology to understand, the emergence and spread of the illness. We can identify potential exposure sites and hotspots, perhaps. And importantly, we can also get information that will help us distribute resources and maybe implement testing. So if we see, again, that it looks like we have a high amount of virus coming out of a nursing home, we want to go in there and do increased diagnostic testing. So I think it's useful for a number of reasons. So the next slide, please. So what are we really doing here at Michigan Tech? I'm leading up two efforts. One is really focused on our Michigan Tech community. We've been sampling since late August, collecting samples from 4 of our residence halls. We take a grab sample between 8 and 10 in the morning from those residence halls 3 times a week. And then we have a point on campus that captures flows from multiple residence halls, and we sample there 5 days a week. And again, the idea is that, if we start to see changes in the virus level, we can go and try and pinpoint where is that virus coming from. And this work is being conducted by really an army of extremely dedicated students who go out in all manner of weather, rain or snow, and collect these samples. And it's hard work. And you see there on the right, 2 of the students who were involved. Here's where we actually were figuring out where to sample and how to operate the equipment and perform the sampling. In addition to the Michigan Tech efforts, and really it was that effort and the investment of Michigan Tech in this wastewater-based epidemiology effort that led to my involvement in a statewide pilot study. And this work is being conducted by about 20 teams that are really partnerships between labs like mine that have the capacity to concentrate and extract the RNA and quantify it using PCR, as well as our regional and local health departments. And then we work with municipalities and the folks at the wastewater treatment utilities to capture the samples. So this effort is really building our infrastructure for tracking pathogens, and really will really aid a number of community health and research-based efforts. So as part of this initiative, we acquired another very sophisticated piece of equipment. It's what we call 3rd generation PCR. It's a digital PCR system that allows us to detect signals like the SARS-CoV-2 virus at very, very low concentrations. Our team, so I'm partnering with the Western UP Health Department and communities throughout our 5 Western UP counties, Baraga, Gogebic, Houghton, Keweenaw, Ontonagon counties, is probably taking on one of the highest, largest workloads. We process over 50 samples per week, and that is turning out to be a lot of work, but it's exciting to be part of this initiative. And again, the building up of infrastructure in the Western UP. And this pilot study runs through the end of December, and we are hoping that we can continue these efforts into 2021. And the data will be combined with our information on diagnostic test results, again, to understand the power of wastewater-based epidemiology for tracking this disease and others in our communities.
Thank you, Dr. Becker. That was very interesting, extremely fascinating. We appreciate, again, I can appreciate the team that it takes to do this. You mentioned students, and Karen mentioned the students, and David talked about the collaboration across departments. I'm just wondering if you can comment. You talked about locally here in the Western UP, the pilot study in the state of Michigan. Long term, do you see this being scaled up, that it could be, you mentioned Europe and other places, but what's the long-term kind of forecast for this, for the efforts here? How will this help as we continue to work through the pandemic down the road?
Well, I think that it's going to continue to be a very useful tool. There have been a few studies that really showed unequivocally that wastewater-based monitoring could be used to detect the emergence of this illness at the very earliest stages, and could be, you know, when health officials acted on that information rapidly, people could be moved into quarantine, and we could really really isolate and limit the spread of the illness. So I think it's a really powerful tool. Not everybody has the equipment and resources, so we're fortunate in that regard, but I think it's highlighted the need to invest in science, invest in technologies. I think it's here to stay, and again, I think it's really powerful. Of course, there's always some variability in the data, and we have a lot to learn. We have to learn how long people shed the virus, how much do people shed, and so forth. So we really would like to link the abundance of virus in wastewater explicitly to the number of cases. That would be, you know, a huge advance. But we do have a bit more to learn about the, like I said, the virus shedding before we can do that. But I think it's unquestionable that we can see trends. We can definitely see quantitative trends in the illness based on the signal that we observe in wastewater.
Dr. Becker, one other question that came in here, talking about sometimes the disparities between urban and rural areas.
Mm-hmm.
Again, kind of thinking down the road, do you see this really emerging in more urban areas first and eventually making it to rural? Can you comment on that?
Well, I would say right now we really are, we're collecting samples from some quite small communities, and so I think it is a technology that can be implemented in rural locations, but what you do have to do is be able to get the sample to a lab that has the capacity to analyze it within a timely manner. So you have to be able to keep your samples cold. And again, they need to be processed relatively quickly. So the Western UP Health Department is putting many miles on their vehicles collecting the samples from us. So we have, again, municipalities doing the physical act of collecting the samples, but then the Western UP Health Department personnel drive around and collect them. So they're sometimes driving 300 miles to bring those samples back to Michigan Tech. So if you're willing to do that driving, we can certainly reach out to rural areas.
Okay. Great, thank you, Dr. Becker. Just want to take a minute here and recognize our sponsors again, UP Health System Portage, Upper Peninsula Power Company, the MTech Smart Zone, Aspirus, and the Physiological Society. We are getting some questions through the Q&A function on Zoom, and also emailing us to townhall2020@mtu.edu. Our next presenter will be Isaac Wiedig. Isaac is a doctoral student in the Department of Kinesiology and Integrative Physiology. He's going to talk to us briefly about how to keep our community healthy and safe during the pandemic. So Isaac, thanks for being here.
Thank you, Dr. Elmer. I've been a long-time listener now of the Town Hall series, and so I'm really excited to be on today with you guys, and thank you for having me on. So as you've mentioned before here on the Town Hall, we all as individuals play an important role in helping to kind of overcome the pandemic. And this includes things like, washing your hands, social distancing, wearing a mask. But I think another really important role that we all have to play is offering our expertise and our knowledge and the resources that we have to kind of aid in the war effort, if you will. And finding some way that we can ultimately, contribute to keeping our local community safe and healthy. And so it's been really cool to kind of hear the other speakers tonight, how they've been able to do this. For me, I study in kinesiology. And so in kinesiology, we're exercise specialists. We study human movement and the way that exercise affects the body. And physical activity is an extremely important aspect to maintaining our health. And we like to think of exercise as a form of medicine. So it has the ability to not only prevent and treat a wide range of illnesses, including obesity, diabetes, cardiovascular disease, cancer, and all these conditions place individuals at a high risk of severe illness and death when infected with the SARS-CoV-2 virus. We also know that regular physical activity boosts immune function. It can decrease inflammation and is even linked to a reduced risk of acute respiratory distress, which is a major cause of death in many COVID-19 patients. So as an exercise specialist, I feel that it's my responsibility, during the pandemic, to bring awareness to these benefits and work to promote not only physical activity, but also other healthy living strategies such as proper nutrition, getting enough sleep, regulating your mental health, refraining from tobacco use. And ultimately what all of these interventions can do is help to create a more resilient population. So if we kind of think about it, our first line of defense against COVID-19 is preventing its spread. But the second line of defense is getting our bodies as healthy as possible so that we are better equipped to handle the effects of COVID-19 if we do become infected. And a healthier and more resilient population is going to be less likely to overburden the health system. And that's something that we really want to try and avoid. So getting our community to the highest possible baseline of health that we can really help to dampen the effects of COVID-19 in our local area. And staying physically active is a really big key to doing that. So one of the things also that we've seen with this pandemic is that people are generally moving less and sitting more. And this is concerning because this means that a lot of people, even if they don't become infected with the virus, are ultimately becoming less healthy as a result of the pandemic. And so this could accelerate some of the negative health outcomes like obesity and cardiovascular disease independent of COVID-19. And so, we really need to kind of think about getting out in front of these negative shifts in lifestyle habits and really actively work to keep everyone in our community as healthy as possible throughout the pandemic. So our goal as exercise specialists is primarily to promote physical activity. And in order to do this, we have a three-pronged approach that we're currently using. And so the kind of first prong is simply increasing awareness of the importance of staying physically active. So traditionally, we've had the 3 W's, so wash your hands, watch your distance, and wear a mask. And we're proposing a 4th W, which is to walk. And so this can just help to, in general, remind people to stay active while practicing those other safety measures. And then our second approach, Doctor, you can continue the next slide. Our second approach is communicating with clinicians and healthcare providers to establish physical activity as a vital sign of health. So we really kind of need to work on getting our healthcare providers on board with our message and helping to spread to their patients in their clinics this importance of being physically active. And so we constructed an infographic shown here on the slide that demonstrates the benefits of exercise and kind of just how to stay active during the pandemic. And this infographic was specifically designed for use by clinicians. And recently we were contacted by Dr. Barry Franklin, who is the director of the Cardiac Rehab and Exercise Lab at Beaumont Hospital downstate. And he's going to be creating a home-based cardiac rehab pamphlet for patients that includes our infographic in it. So it's really cool to kind of see our work getting out there and spreading, being used by physicians to ultimately spread our message of using physical activity. And then lastly, our third approach is offering community-based exercise programs, such as Up and Moving, which have been mentioned a few times here in this town hall tonight. And then there's also another program called Move for Health, which is run by Central Michigan's physical therapy program. And that program is directed towards patients with Parkinson's. And so both of these programs provide opportunities for members in the community to engage in virtual exercise sessions. And specifically with the Up and Moving program, we offer these live exercise sessions 3 times a week. They're led by graduate students in the kinesiology and integrative physiology department at Michigan Tech. And if you're interested in participating, you can visit the website, upandmoving.org. We have all of our previously recorded exercise sessions there. And you can also find links to our future live sessions that we'll be running. And those are offered every Tuesday at 6 p.m., Thursday at 9:30 a.m., and then also Saturday at 10 a.m.
Isaac, a question for you. Thank you for your presentation. How much physical activity are you recommending? So for adults, for older adults, for even for students, what's kind of that amount that would go along with your recommendations here?
Yeah, that's a good question. In the general recommendations for adults are to achieve 150 minutes of moderate intensity exercise a week. However, I think it's important to note that, while 150 minutes is a good goal, and that's, where you can really see some substantial health benefits, any amount of physical activity is going to provide benefits for you. So even if you don't achieve that 150, it doesn't mean that, any less amount of activity below that, you see no benefit. So really just anything, and maybe if, you're starting from a place where you're not doing, a whole lot of physical activity, just bumping it up a little bit, you can see some benefits and some improvements in your health from that.
Now, Isaac, what type of equipment do folks need to, sort of get some of the benefits that you're highlighting in your presentation?
Absolutely nothing. There's nothing that you need. So I mean, any type of movement, you can just use your body weight. If you can get your heart rate elevated, that's perfect. You can do, we can kind of divide exercise into, more aerobic or cardiovascular exercise, which is very easy to do without any equipment. It could be a matter of, walking in place or doing jumping jacks in your living room. And then, I mean, if you're looking more for like strength training, there's, a number of body weight exercises you can do. Sometimes you need to be a little bit more creative if you're stuck at home. Maybe use jugs of water. A gallon jug of water can be a great 8-pound weight. Push-ups, body weight squats. So yeah, I mean, you don't really need any equipment at all. You can do it all from home with just your body.
Okay. Thank you, Isaac. I'm going to bring in Dr. Kelly Kam here, our epidemiologist. We're getting just about to the end of the town hall here, so not too many questions left. But Kelly, there was a question that came in. I know a lot of people are traveling, will be traveling over Thanksgiving, students and community members. What about flying? And the question here is, do the risks change? And would you recommend that people not fly?
Well, I think you still need to keep your remember all of the safety precautions that you can take. Treat everybody as if they are infected. So make sure to keep wearing your mask. The airlines have done, do your homework to check on your airlines. Different airlines have different recommendations. I believe most of them are requiring masks for anybody who's traveling. And also take personal responsibility for yourself. If you are under quarantine or under isolation, you should delay your travel. There's you should not be putting other people at risk for your travel, but by all of us taking those measures, then we hopefully will protect other people, especially when you're in any public area, crowded areas. As much as possible, try and keep your distance from people. Remember to wash your hands in any public area, and that's good advice no matter if we're in a pandemic or not.
Well, I wish we had more time for more questions. I want to sincerely thank all of our presenters tonight. Really briefly here, if I can advance my my slide. But yeah, thank you to Karen Fay, David Holden, Dr. Jennifer Becker, Isaac Wiedig, and thank you to you, Dr. Kelly Kam, for everything that you're doing as well. We really appreciate your time tonight. I know, Isaac, you have a class to teach at 8 p.m., so you're doing a lot here, so keep up the good work. And most importantly, I think it really speaks to the collaboration, the team effort, everybody doing their part here on campus to make a difference on our campus and also impact our community. So thank you to all of our presenters. I need to thank our sponsors one last time. UP Health System Portage, the MTech Smart Zone, the Upper Peninsula Power Company, Aspirus, and the Physiological Society. Coming up, we have 2 more town halls remaining. Next week, we'll talk about COVID-19 and how it's impacting the economy. We'll take a week off for Thanksgiving. December 3rd, we'll wrap up with COVID-19, talking about health disparities. Remember to go to our website at mtu.edu/health-research. You can click on Town Hall and pull up our previous recordings if you missed any of tonight's recording or want to go back and view some of our previous ones. There are a number of people working behind the scenes. We appreciate your help and providing the Town Hall platform for Dr. Kam and I, and we certainly couldn't be up here without your assistance as well. Finally, thank you to all of our listeners out there on 97.7 The Wolf, all the viewers on social media and Facebook Live, and those of you that were sending in your questions and with us on the Zoom. We appreciate your enthusiasm, your interest in the series. We're doing our best to provide the credible information and rely on local experts here to share their perspective and recommendations and answer your questions. So we'll see you next week. Have a good evening.